Continuing along the lines of responsibility and going back to what I've said in the 2004 parts, that you have two jobs and I have two jobs, and they're not the same ones. And let's talk today about one of your responsibilities, which I call plaque control, or we can call it daily home care, daily care, the things you do every day to take care of yourself. And I want to just talk a moment about the concept, the idea of frequency versus intensity. Frequency versus intensity. I think a lot of us want to avoid the treatment of others, and that makes complete sense. And in fact, I encourage you to take as good a care of yourself as you can so you don't need other people like myself for very much. The problem, however, is when the line is crossed to where what you are attempting to do to help yourself doesn't help and actually turns into injury. I saw a patient the other day, and this is not uncommon. She's come back for a post-operative visit after a procedure, and I look at the tissues and overall they look healthy, except there are abrasions. And so I pointed this out to her to say, your intensity of brushing is way off the norms. You are trying to do something with a toothbrush that is not useful when it comes to its purpose. So let's go back to what's the purpose of brushing. The purpose of brushing is disruption of bacterial colonies. It's not killing bacteria. It's not eliminating bacteria. It's disrupting colonies. So what does it take to do that? It takes frequency because they colonize all the time. So you have to have a habit daily disrupting these organisms. And you do this with a soft bristle brush because a stiffer brush, a medium brush, is more injurious and doesn't improve the effectiveness of colony disruption. Secondly, you have to agree that when you're working between teeth, organisms can colonize where a toothbrush never reaches. Therefore, flossing and brushing are necessary to address all of the tissues that the tooth is surrounded by disrupting the colonies off the teeth. Which also points out that there's nothing you're doing directly to the gums. You are allowing the gums to heal themselves because you're not injuring them, and you're disrupting the bacterial colonies that are primarily sticking to the hard surfaces of the tooth. So, frequency, not intensity. It is better to do a weaker job and not disrupt at 100%, say you're disrupting at 80%, it's better to do that and then do it every day on schedule. And I would say brush twice a day, floss once a day is reasonable, unless there are specific circumstances in your particular case where your dentist or hygienist gives a different recommendation, in which case that's unique to you, and I would follow that. Not somebody who's just talking to you in generalities like myself at this moment. But in general, for most people, if you're brushing morning and night and you're flossing once a day, can you do it more often? Yes, gently you can if you want to. If you find that you're getting food caught between teeth, all the rest, you can certainly do it without feeling any guilt or anything at all. Just do it if you wish to. But the disruption at 80%, gently, every day, is more effective long term than intensity once in a while. And if you want to know the answer to the question, are you flossing? The answer is yes, if you're doing it every day, and no, if you're not doing it every day. Even if you're flossing 6 times a week and you miss a day, I would tell you the answer is no, you need to do it daily. And when you're there, then the answer is yes. To me, I think I would make it more black and white, not more nuanced. It's a yes or no. You floss daily? Yes. You're not flossing daily? You're not there yet. And you're not using the floss as a prevention for bacterial colonies to disrupt them. You're using floss for other reasons. You're either attempting to cure something, which I don't recommend, because the tissues are already injured, so don't floss intensely and seek help, or you're just using floss for other uses like removal of food. So there it is. Frequency, not intensity. Have a great one. Thanks for listening. A dinosaur with an extensive vocabulary is called a thesaurus. Now go floss.